back to the thyroid, that thyroid liver connection, because, okay, I've got unexplained weight gain and I'm fatigued, my hair's falling out. Well, yes, your liver could be causing the thyroid symptoms that you look on the hypothyroid symptom list, but
Mhm.
they're interrelated.
Yeah, exactly. I mean, I see so many people where they've been diagnosed with a thyroid problem. Most common is hypothyroidism, so a sluggish, like slow thyroid is how we would quantify that. Where they're really struggling with those symptoms that you talked about, like weight gain, hair loss, dry brittle nails, and skin and hair and dry eyes. For women, like losing the outer third portion of their eyebrows can be really common. And so they'll get slapped with this diagnosis and they'll be given thyroid medication. And that thyroid medication will maybe provide marginal symptom relief, but it doesn't solve the problem. Because as we're saying here, you guys, is like, is it really a thyroid problem? Like, what's going on downstream that's preventing the thyroid hormones from doing their job, right? So I really want to paint the picture for people to understand their thyroid function and how this works and why this is often overlooked if you're going to the doctor and being told that everything's fine and that you should just take thyroid medication. So first of all, if you suspect that you have a thyroid problem and you haven't been diagnosed with that, one of the reasons why that might be is because the most common thyroid marker to look at from a traditional conventional perspective is something called TSH, which is thyroid stimulating hormone. And TSH is actually produced by the pituitary gland in the brain to tell the thyroid to then release thyroid hormone, what we call T4, which then gets converted into thyroid hormone T3, essentially. And T3 is what gets taken up into the cells so that our thyroid hormone has this positive impact on the body to help us lose weight, regulate metabolism, regulate, our body temperature and whatnot, right? So a couple things can happen here is that oftentimes the traditional system is only looking at TSH, and TSH might be within their clinical reference range, which is often very wide and not an interpretation of what is optimal. So
Right.
optimal ranges for TSH are much more narrow, like generally speaking, zero point 0.5 to 2, versus that clinical reference range for diagnosis is like zero point 0.5 to 4.5. And so you maybe just not like within that clinical diagnosis. Like our system is built to look at and provide diagnosis based on when something gets so severe or bad. It's not looking at what's optimal for you, right? So, but that's only one piece of the picture if you consider what all I just described and how like TSH is not even thyroid hormone. It is from the pituitary gland. And so then we want to look downstream and see what's happening. And a lot of times, when people are getting a hypothyroidism diagnosis, it's because their T3 is low. And as I just said, T4 is converted into T3. So wouldn't it like rationally make sense to wonder about that conversion and what's happening there?
I'm
If we
married
start
to
to, yeah,
that.
if we start to put on our critical thinking caps,
Right.
right, and go, like what's going on with conversion, especially when maybe you have like a decent amount of T4 that's being produced. It's just the T3 that's low. But even so, we want to look at both of these things. So, as I said earlier, there's a large majority of thyroid hormone that's converted in the liver and also in the gut tissue.
So I want to stop you right there. My liver numbers, I had a traditional doctor look at my thyroid numbers. My TSH was very low, my
Mm-hmm.
T4 was very high, and my T3 was low, and my reverse T3 was high.
Mm-hmm.
So that doctor said, "You're hyper. Your TSH is too low and your T4 is high." And I'm like, "But my T3 is very low." Then you go to a doctor, and I know you know Dr. Amy Horniman. She
Mm-hmm.
says, "Sarah, you're hypo. How can I get the exact opposite diagnosis from two different people?" So
Yeah.
it is, and it was all because my liver. And then another factor, my daughter was having, she was low progesterone, estrogen dominant, and that was part of her hormonal issues with her periods being very bad.
Mhm.
And The one doctor wanted to put her on progesterone. At least it was bioidentical versus the pill. But what we realized is that was going to make her feel worse because her liver couldn't even process the hormone because it's fat based, and she couldn't even process fats. So she had to be on a very low fat diet for
Mhm.
a short period of time, even a vegan diet for just a couple days to give her liver a break. And
Wow.
then we did some other things, got to the root of the problem instead of just throwing hormones at it, whether it's a thyroid hormone or sex hormones. You're just trying to mask the problem and not getting to the root of it. The body is screaming. Your symptoms are they're a gift. They're a
Yes.
gift from your body saying, I need help here. Can we dig a little deeper and find those root causes
Right.
versus just throwing these blanket medications to cover them up?
Exactly. And just a little side note on that is that elevated estrogen will trigger hypothyroidism or Hashimoto's or other things. And that's actually what happened to me. So I mentioned earlier that my skin cancer was my first health hurdle that I overcame. Later in life, we had mold in our house that for I don't even know how long that we didn't know it was there. And I was feeling like I turned 30. I got married that year. I was like ideal weight, like feeling great. And then I started working from home because this is when I really started my practice. And I started working from home as an entrepreneur. And over the course of 2 years, I slowly gained 15 pounds. I broke out with cystic acne. I never even had acne as a teenager. And all of a sudden, I had adult cystic acne. I was having cyclic breast tenderness that was so painful to the point of like one day I woke up and you could feel the heat coming through 2 layers of clothing. They were like, I had this huge red streak on my breast. So here I'm freaking out, going, well, I had skin cancer. Is this breast cancer? And obviously it wasn't. It was toxic mold, but this was all from the estrogen that was in my body. And what happened was this like domino effect where then it triggered hypothyroidism and Hashimoto's. I had thyroid antibodies. So I did exactly like what we're kind of talking about here is I took in that information. I eliminated lectins from my diet, those foods that were triggering those antibodies. And I took supplements to support my body in the healing process. But I also had to take a look at eliminating the toxins, the mold toxicity that was burdening my liver, that was creating mold is also a xenoestrogen. So it creates excess estrogen in the body to get my thyroid back in balance. And I will say, this is also, I think, just something to consider. Like, I made a conscious decision to take the smallest amount of thyroid medication, a natural thyroid medication, not synthetic. So there are natural alternatives out there to support my body while I worked on all of these environmental and lifestyle
Yeah.
factors, right? Because I was feeling really low at that time and I knew that my body needed that support. I was off of thyroid medication and in remission from Hashimoto's within 6 months.
Amazing.
So it's not a life sentence, right? And I think that we do want to, again, just do some critical thinking and go, okay, I'm going to make a conscious decision to support my body in this way right now while I'm working on the downstream, root causes of essentially what is going on, basically,
Yeah.
right?
Yep.
So, for going back to this liver gut connection, we just want to acknowledge that all of the systems of the body work in synchronicity together. They are not individualized, they're not a silo, like, which I think that the structure of our conventional system kind of makes us think that, or that's just been the standard of care. Like, you go to an endocrinologist
Mhm.
for hormones, you go to a gastroenterologist for gut stuff, but like, those people aren't talking to each other. So we want to look at the whole picture and ultimately go, how are all these things connected? And then what are the patterns and correlations that we're seeing here, and how do we utilize that information to then inform the decisions that we're going to make to support our body and ultimately get it back into balance? Because, as we said earlier, the body wants to be in balance.
I love that you brought up that the doctors are not talking to each other. My mom had a horrible fall, fell off a horse, broke her pelvis, had to be on medication. The medication made her liver enzymes go real high. So she was then on a steroid for the, of course, against everything that I was telling her to do. But she's 80 and she's scared, so she listens to her doctor. But she even said, Sarah, I asked my bone doctor what he thought of me being on a steroid for my liver. And he said, and the doctor said, quote unquote, I have no opinion. That is not my expertise. That is not my area to focus on. And she's
Mm-hmm.
like, are you kidding me? These doctors have no idea what each other are telling the patient.